above and beyond to help us respond to the pandemic, and we have tried to step up in turn for them, and that's what I'm here to speak about today. They recognize, these agencies do, the real need that is out there because they deal with it day in and day out, and they have been put in a particularly difficult position themselves during the pandemic, which I'll make reference to later. So back in June, to help address this, both the need and the expanded range of services they were providing in partnership with us, and also the circumstances in which these agencies found themselves, back in June, we allocated $2.81 million to 50 community-based agencies as the first round of investments in those agencies and in the services they were providing, in particular during the course of the pandemic. Through this funding, they've been able to achieve great things across the board. I'll give you a couple of examples. 25 new food support programs were initiated as a result directly of this extra community support funding. And the funding also went, in the case of a couple of the organizations that were beneficiaries from that first 50, to provide the resources necessary to answer 2,700 calls a week dealing with mental health issues. And I think we've been doing a better job, albeit that we still have a long way to go on mental health. We've been doing a better job in the pandemic of providing help to people on the spot, as it were, so they can call and get help right away and directly. So we're here today to announce the second installment of the city's TO Supports Investment Fund. And this again will go to community-based agencies who are supporting vulnerable residents impacted by the COVID-19 pandemic. I'm very pleased to announce with my colleague Anthony Peruzza that approximately $1.9 million in additional funding will be distributed in the second round of grants from the TO Supports Investment Fund. This is the result of a lengthy process of looking at the grant submissions that have been made and making decisions as to where that can be best allocated. A third round will be available in the not too distant future, amounting to more than $2 million additional dollars of community support for these organizations. The second round of funding will be distributed to 33 community-based agencies supporting vulnerable populations. The TO Supports Investment Fund was created for the purpose of investing in partnerships with social service agencies to help support the urgent needs of vulnerable Toronto residents. The funding has been created from the $2.81 million portion of the city's allocation of the province's Social Services Relief Fund. And I thank the provincial government for this support that's being given to cities and towns across the province, but that includes the City of Toronto, and we're very grateful for the fact they've stepped forward to recognize this particular need among the many areas in which they and the federal government are helping. The need to step up and support these community organizations is very real. The first round of funding from the province was supplemented by money from the Scheinberg Relief Fund at the Toronto Foundation and funding from the Canadian Medical Association and the Federation of Canadian Municipalities. This round, again, will be invested in community agencies. And many of these are partnering with the city in the priority areas of housing and homelessness, food access and security, family support, mental health support, income support, social connection, community sector support, and community safety and well-being. The 33 community-based agencies were selected to receive funding based on their capacity to respond to the urgent situation and to the unmet needs of Toronto's most vulnerable populations. And with their established relationships in local communities, the agency partners can also, because they know who's who and what's what, they can get help to those who need help quickly and efficiently. From the second round of funding, I want to highlight where some of the funds are earmarked in particular. $250,000 is recommended to be allocated to 4 agencies working with people with disabilities. $140,000 is being directed to Indigenous agencies on top of a much larger sum in the first round, and $918,000 will go towards COVID-19 responses led by Black agencies in the City of Toronto. Once again, we are focusing on community-based agencies that support Black and Indigenous communities to ensure that the needs of these two more marginalized communities are met. It's clear from the Toronto Public Health data that marginalized communities are in fact being more heavily impacted upon by the COVID-19 virus. I hope this additional funding will help these agencies to provide more help to these communities. The full list of community-based agencies that are the beneficiaries of this second round of 3 will be available and is available as of now on the city's website. As this pandemic continues to impact the city's residents, I want to ensure that people out across the city understand that we're actively advocating to all levels of government for increased funding to support the emergency and recovery needs of our communities. We know that we can't do this alone, and we know that this new funding isn't a long-term solution. We need help now, people do, with the help of the province of Ontario. For example, we're providing some additional funding to help address their needs in this round of funding, but we know that there are more permanent and more broadly based solutions that are at hand. I was texting as recently as this morning with the Deputy Prime Minister. I'm in touch almost daily with the people at the provincial government. I spoke with the Premier last night, and we're trying to turn our minds not just to the urgent needs that exist today and filling those needs, serving people and supporting people, but also to the longer term and trying to keep going. Quite frankly, some of the things that have been very successful during the course of the pandemic, many of them in partnership with the very same agencies that are the beneficiaries today. I should say a word of thanks as well beyond the nonprofit organizations to our public service, because they've been entirely focused on serving people during the course of the pandemic. They have been the ones that have either broadened or established the partnerships with the community organizations and have done so in a way that has been efficient, it's been quick, and it's been very effective in terms of helping people and getting the help to people as quickly as possible. A final word of thanks I should offer is to the agencies themselves. While they've, yes, been doing tremendously hard work, which is an expansion of the mandates they normally fulfill, that's why they're good for us to be partners, because they are experts and people who know the clients very well that they're helping to serve and to support. They've also had their own crisis to contend with. The kinds of grassroots fundraising events they have relied on through time to fund themselves have been very difficult, if not impossible, to hold, and donations coming in, as has been the case with many different charitable organizations, basically dried up. So that this help that we're able to give, while it's modest in some respects relative to the scope of the challenge, I think it is meaningful to them in replacing some of the funding that they just haven't been able to access during the course of the pandemic. I also want to one more time thank the province of Ontario for their contribution to this TO Supports Investment Fund. They have stepped forward with this money, which is left to us to distribute to the agencies that need it the most. And the first two rounds, I think, have proven to be helpful to agencies that are doing wonderful work for us out in the community. And the province recognized that from the beginning and allocated this money, which we in turn are allocating out over 3 different tranches. One more thing I'd like to make reference to today, and it is, again, on the other end of this job, which is economic development and the creation of jobs. In the end, the thing that is going to best help people out of poverty in non-pandemic times and people to recover from the strains and stresses of the pandemic is to make sure that they have and keep good, secure jobs. And of course, there are many jobs that have either been threatened or worse during the course of the pandemic, especially in the restaurant and hospitality industry. Today begins a 2-day process whereby the Planning and Housing Committee today and the Executive Committee tomorrow will be considering measures to try to help restaurants a bit further by making it possible through increased flexibility and waiver of fees and things like that to keep some outdoor dining available to people where possible in the winter months. Today, the Planning and Housing Committee will be extending the zoning bylaw amendments that we put in place earlier this year to help patios. This will continue to ease restrictions on outdoor patios through the winter and into the spring. And I recognize the fact that this will be of help to a modest sized group of establishments, but nonetheless, we want to make sure that nothing is standing in the way from a regulatory standpoint of these establishments that can do so, taking advantage of the opportunity they have, as other cities have done. In fact, one of the things I talked with the Premier about last night, we were talking about the number of cities that have used these bubbles that you may have seen as a way of having dining that can carry on outside of the indoor portion of restaurants during more inclement weather. And they've been in use in many cities. In fact, they've been used here in some instances in previous years. And these are the kinds of innovations and ingenuity that we would like to permit restaurants to demonstrate if they can. And so we're just making it such that we're not standing in the way of that. This series of changes at the Planning and Housing Committee and the Executive Committee will also allow a modest increase to the maximum size of outdoor patios and remove restrictions that might prevent an outdoor patio being located in front of a building. So we're really trying to the maximum extent possible, given snow clearing and all kinds of other things, just to get out of the way to make it possible for people to maximize their opportunities to take in revenue. I know this is a difficult time for restaurants, and that is why I've been working hard at the winter patio, the summer and fall patio scene, where we made a number of dispensations to try and make things more flexible, and why I've been fighting hard on issues like insurance and food delivery fees because I recognize that these organizations need all the help they can get to stay in business and leave alone to get back to more normal kinds of results and levels of business. Um, I'm working with the transportation officials as well to make sure that we can do everything possible on sidewalks to encourage winter patios as well. So bottom line, and I had a very excellent summit meeting yesterday with the restaurant, hotel, and performing arts industries or sectors. We're going to be doing everything we can, including advocacy together governments, to try and make sure that these folks are given a chance to survive, because they do tell you when you sit and talk to them, as I did both Friday and Monday, that survival is the first order of business here, not trying to get back to any kinds of positive results, just survival. And we're anxious to make sure that we can make that happen for as many of them as possible. And this is part of supporting the city during the pandemic as well. So those are my remarks for today, and myself or Councillor Perutz are available to answer your questions.
Thank you for joining us today. We will now open the floor to questions. As a reminder, it's one question, one follow-up. On the line, we also have Denise Campbell, Executive Director of SFDA. First up, we have Mark McAllister from City News. Go ahead, Mark.
Good morning, everyone. Mayor, if you could, just to spell out the need to continue to fund these programs, why you felt 2.8 million wasn't going to be enough, and why you needed to get into a second round and perhaps a third round down the road to make sure that the money keeps flowing.
Part of the reasons for the 3 rounds is that we want to make sure we cover a broad range of agencies, because there are many, many agencies we form partnerships out there with to serve the elderly, to deal with food security issues, to deal with homelessness. And we want to make sure that we cover a broad range of agencies as well. The pandemic is going on for some period of time, so we thought it wise at the beginning, when we got this lump sum of money, as it were, that we should allocate it out in stages to help people to get through what has turned out to be a fairly lengthy period, which isn't over yet. So I think that those 2 things still stand. Today, heading towards the 3rd round, which is we want to make sure we're giving it to the right people at the right time, and meeting the right needs. And I think with the needs that I mentioned, homelessness, food security, and other such issues, elderly, mental health, we're doing just that. And I realize this is modest help, but it's some additional help that will make a big difference to organizations that are doing great work for us and that have really been cut off some of their sources of funding that they get through charity and donations and so on.
Obviously, all of these things that you had mentioned are important things that need to be done. You did reference very briefly some of the COVID response that is needed as well. I believe you referenced it with regard to some of the Black-led agencies. Could you speak more about what exactly is going to go into the COVID response in some of these areas?
Well, what these agencies are doing is helping people, in some cases, directly with some of their health needs related to COVID, to make sure that they can, know how to isolate themselves, know when to get tested, get them, access to healthcare directly related to COVID. But in many cases, it's also the consequences of COVID that we're dealing with here. For example, the mental health trauma that has been experienced by many people who have not had COVID at all, but they've been stressed by the fact that many of their neighbors have, some of their relatives have, and that they're living, for example, in very confined circumstances in their housing, which puts them at risk. And so if you look at the list, it's a very broad range of services that are being provided to people, as we wanted to be the case from the beginning. Some of it very much related directly to COVID and to health-related concerns, other things related to the consequence of COVID, such as food security issues or homelessness, occasioned by people losing their jobs or having disruption in their families.
Okay, next up, we have Nicholas from Radio Canada. Go ahead, Nicholas.
Hi, Mayor Tory. Thanks for taking our questions. You briefly touched on the impacts a few moments ago felt by the hospitality industry, and it employs thousands of Torontonians. And the Greater Toronto Hotel Association has asked for government support to help hotels survive the next several months. So, what can the City of Toronto do to help the industry?
C'est difficile pour la ville de Toronto, mais ensemble avec les autres gouvernements, c'est possible d'aider les hôtels. Les hôtels ont participé dans notre réunion hier avec les restaurants et aussi les organisations artistiques. Ils ont un grand problème. Ils n'ont pas les visiteurs dans les hôtels, mais les coûts fixés n'ont pas disparu. Ils ont besoin d'aide avec liquidité et c'est une situation pour le gouvernement du Canada, je pense. Et aussi, ils ont besoin, les messieurs, par exemple, par équilibrité, les impôts équilibrent entre, par exemple, les hôtels et aussi les organisations comme Airbnb. Ils ont besoin aussi un programme comme visite un hôtel à Noël cette année. Un programme de promotion comme ça et c'est une possibilité pour la ville de Toronto introduire un programme comme ça. So what I was
Merci.
saying, for those who might want that answer in English, is that when we talked about hotels yesterday, like all of the organizations we had on on the WebEx, all of these organizations, arts, restaurants, and hotels, have a liquidity problem. They have bills to pay just to even keep themselves going at a subsistence level that are far in excess of the revenues that are coming in from, say, takeout or very limited patio dining. In the hotel case in particular, they all indicated they have a liquidity problem because they've had 10% occupancy for some considerable period of time now, and it's gone up a little bit over the summer and now back down again with the advent of fall and some of the additional shutdowns. And so I have indicated to the other governments in the wake of these summits that we convened that those kinds of measures to help with liquidity, as well as equitable tax measures for hotels, for example. They raised in particular the fact that they pay what they believe to be an unfair level of taxation. And I think there's some merit in their thinking relative to an organization they see themselves competing with, like Airbnb. And so that would be something that would be a great assistance to them. And they also mentioned yesterday, just to complete a summary of a couple of the items, that we could be helpful to them, we collectively, but I think this is something that could be more locally done in Toronto to run a promotion, for example, saying to people in the GTA, come stay at a hotel as part of your Christmas celebration this year, stay in a hotel in downtown Toronto and give them some business and have a bit of fun while you're at it. So, I think, as usual, the municipality is not in a position, the city of Toronto, to help with liquidity issues by itself. But I have been in touch with the other governments about these very specific concerns raised, as well as those raised by the performing arts organizations and restaurants in our meetings over the last couple of days.
Merci beaucoup d'avoir répondu en français. C'est très apprécié par les francophones de Toronto. I have another question for you, this time about an editorial that came out in the Toronto Sun yesterday. It's on trick-or-treating. Essentially, I'm just going to give you a couple of quotes if you haven't read the article, but it says, if you want to do it, go right ahead. It also says, we think it's mostly safe as is. So this editorial seems to go against what Dr. Davila is saying on the issue. I just wonder if you have a comment about that editorial.
Well, I pay very close attention to editorials, but I pay even closer attention to the advice of our medical officer of health. And let's remember first that this was a recommendation made by the Ontario Medical Officer of Health, a recommendation. And I guess the editorial is correct in saying that when recommendations are made, people can choose to follow those or not. One of the reasons that I accept reluctantly I say because I know how much Halloween means to families, including my own, is because I know it's going to disappoint a lot of people. But I also know that all of these medical officers of health, the provincial one, the local one here in Toronto, and all the others, many of whom concurred in this advice to recommend that people not do a door-to-door trick-or-treating, had thought about it and agonized over it very, very carefully. We're just trying to put forward to people the best advice we can of the experts and to do everything we can to help people get through this pandemic and get through it with their good health, not putting at the risk of their older relatives or anybody, making sure we can keep the schools open and the childcare open. And there's a lot of things I've had to stand here and say that were distasteful or very regrettable on my part in terms of canceling different events and recommending people not do this or not do that. But we're just doing it to try and keep people healthy and in the best interest of getting through this nightmare as quickly as possible. And sometimes you have to stand and say things that are not things you'd rather be saying, but they're based on expert advice, and I'm comfortable with that.
Thank you. Next up, we have Julianne from Radio Canada. Go ahead.
Bonjour, Monsieur le Maire. I'd like to go back to the self-isolation center that Toronto opened about a little bit more than a month ago for those who can't self-isolate at home without risking to infect their family members. Has the experience been successful? How busy has the center been? Are there plans to expand it?
Well, we've always contemplated the possibility of expanding it depending on the need. And I can just tell you that I don't have the numbers at hand, but I know that from the comments I've heard from the medical officer of health, that it has been successful in that it has provided an opportunity for those who've taken advantage of it. And it started slowly and it's built up, and I'll have to get you the numbers on where it stands today. But I think the very fact we have offered to people who are from marginalized communities who often live in very confined and often crowded, overcrowded housing, a chance to have a real opportunity to both recover themselves, but also, just as importantly, not to infect other people in their households. And in a lot of these areas where we've seen higher rates of infection, it's been in part because of the housing circumstances of some of the residents. So in that sense, it has been successful. We always contemplated, if necessary, we would expand it. I haven't heard anybody coming forward to say that we needed to seek additional funding to do that as yet, but I will get you the numbers on the occupancy so that you can have that as part of your account.
Merci beaucoup, Monsieur le Maire. Another question. Only a fraction of Ontario's COVID-19 cases have used a national COVID alert app to report their infections. We see that there's an increase of cases in Toronto today again. Do you think that the tool is effective? What's your message to Torontonians regarding this app?
I will tell you, I think the tool is very effective. I have it on my own phone and I check it every day to see if I've come in contact with anyone, because I'm out and about in the community a little bit, and many people are going to school and going to work and other places on the transit. And so I would say to people out there, download this. It takes 2 seconds. You know, I'm not the most technically advanced person in the world, but I downloaded it in 2 seconds and I can look at it every day with ease. There's some big advertisements that have appeared in the newspapers and otherwise on media today encouraging people to do this. This is a tool where you can help yourself and keep yourself safe, but you can also help the governments to have more and more people. Ideally, everybody could have this downloaded on their phone so they would know if they come in contact with anybody with COVID-19 and could take steps accordingly. So I do think there is no reason whatsoever why people couldn't download this app. And I found it in my own personal experience, and I've heard nothing other than that it is effective to do the job that it's meant to do.
Okay, thank you. Next up, we have Haley Cooper from News Talk 1010. Go ahead.
Thank you. Mayor Tory, just a clarification regarding restaurants being able to keep patios open through the winter if they choose, whether it's by installing those dining bubbles that you talked about. If the patio's in a curb lane of traffic, will it have to be moved, or will the bubbles be allowed to sit in that curb lane? And if they are, how concerned are you from a safety perspective once those roads get slick?
No, we had previously announced, Haley, that as much as we would love to leave the patios in the curb lanes, all of those patios will come out. So what we're dealing with here is others that can stay longer on sidewalks, on private property and other places, but the ones on the curb lanes are coming out starting, I think, this week. And there's a very simple reason for that. Notwithstanding the concerns that you expressed with regard to safety, the bigger challenge that we face is we have to plow the roads when it starts to snow. And the reason that they're starting to come out now is because historically, as much as I hate to mention that, just as I don't like to have to pass along advice with regard to Halloween, it is soon going to snow. And we have a responsibility to keep the roads clear. And obviously, if there's a patio in the curb lane, it is not going to be possible for us to clear the roads properly. And then, of course, even if you did clear the other lanes, where's the snow going to go? So the ones in curb lanes will be coming out and will all be gone by mid-November because of the advent of snow and winter. And it is all the other ones that raise the possibility, with increased flexibility from us, the waiver of fees and things like that, assuming they're all approved by the City Council, to remain in place over the winter. And there'll be various other requirements that have to be met in order to keep people safe. But that's the objective here, is to have those patios that are on sidewalks or other places on the land, not on the street, to be kept in place if people can find the resources and the determination to do so.
Thank you. And my follow-up, given all the talk about fitness classes and gyms and the potential risk they posed before Toronto was moved back to a modified stage 2, are you comfortable with the fact that dance classes can resume? And you mentioned that you spoke with the Premier last night. Did this come up?
No, I discussed with the Premier Halloween. We discussed restaurants and bubbles and patios and a number of other things. We did not discuss dance classes, but I will say this. I am very satisfied that it is safe and appropriate to allow dance classes to resume, because not only are they faced with and imposing on their own significant physical distancing requirements, but they're also organizations that rely on a fixed enrollment, so that you know who's showing up, how many people are showing up, and it is therefore possible for you to manage those people in a way that preserves their health. And so I think the provincial government made the right decision in altering their orders to permit those dance programs to continue, and that's what's going to happen now.
Okay, thank you, Haley. Next up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, good morning, Mayor. I'm just wondering if you can tell me when that third round of this funding is going to be made available.
I think it'll be within the next month or so. It'll certainly be before the end of the year. We go through a process where we receive applications or requests for funding, and then they're very carefully reviewed by a combination of people from community organizations, from city staff, and from from the government, and also assessing what the needs are, because the needs have, well, they've remained constant in many respects in those 8 priority areas. They have shifted. I don't know if Denise, who's on the line and who's been so much a part of making sure all this happens in the way that it has, which I think has been seamless and effective, whether she's able to be any more precise in terms of the date. Denise?
Thanks, Mayor Tory. So you're absolutely right that we are wanting to monitor this current phase of the pandemic to see if there are new or different needs and what those community requests will be. And then we will do the 3rd allocation. So as you mentioned, likely towards the end of this year will be the 3rd allocation for work and responses through the holiday season into early next year.
Thank you.
Okay.
Thank you very much for your leadership on this. Matt, did you have a supplementary?
Yes, thank you for that. The second one is about the patios. Following the decision from the Planning and Housing Committee, how quickly will the city actually roll out a plan for the implementation of this? And before that happens, does it have to go through that public health veil?
So what will happen is this. The matter will be considered that has to do with zoning at Planning and Housing today. Tomorrow, I will bring on to the agenda of the Executive Committee a short report that deals with some other aspects of this that are related to transportation and to other kinds of flexibility, including fees. Those will both, one assumes, be approved by City Council next week. But in the meantime, I think the restaurant operators will be able to see what they can do. And in many cases, what we're talking about here is extending the permission and the flexibility to have the patios on a larger basis that are already there. So it wouldn't be a matter of them having to do necessarily anything more. But in terms of people who might be putting up tents or using heaters and so on, they will then have to go through a process which mainly has to do with safety and making sure that the rules that are put in place as of City Council next week are followed. But I think, like we did in the summer, the objective will be to get this done very quickly for those who are interested in doing it, because they need the help and the seats and the opportunity to take in some revenue now, not months from now.
Okay, thank you. And last question is David Ryder from the Toronto Star. Go ahead, David.
Good morning, everyone. This is a question maybe for Denise, but somebody else could jump in. I just wonder, since the first round of funding was flowing when it was the warm winter months, if now that we're heading into a combination of cooler weather when more people are going to be inside and also an escalating COVID counts, if that changes the kind of community need for mental health supports or anything else.
So certainly we continue to see a steady need across communities for mental health supports, and a number of the grant, the funding recipients through this allocation is to ensure that people have access to the supports required. There is, agencies have been talking about increased isolation, particularly around among seniors or those living alone, paying particular attention to domestic violence and child abuse as people find themselves again in very stressful circumstances and wanting and needing to reach out. So we're paying particular attention. Mental health is not the priority of or the purview of the city alone to be responding to. That is provincial funding that's required as part of an appropriate mental health infrastructure. But certainly community agencies continue and residents continue to tell us that they need support. So that is why it's one of our priorities in providing agencies with supports to appropriately respond to families, seniors, and individuals that are struggling at this time, and will the more that they have to stay home and continue to be isolated at home.
Thank you. And my follow-up question is for Mayor Tory, and that's on the trick-or-treating issue. I know that after the Thanksgiving advice that was different from the province and the city, Mayor Tory, both you and Dr. Davila said that caused public confusion. So you wanted one piece of advice coming from, in this case, the provincial government on Halloween. But now we have a lot of experts questioning that advice and saying that there are ways to trick or treat carefully. And I think I'm seeing the same kind of public confusion. Can you comment on that?
Well, it's unfortunate, but experts, whether they're lawyers or doctors or scientists, are going to have different opinions. That's the way of the world. I guess we have our experts, and in that sense, we have a provincial medical officer of health, and I was one of those at the forefront of urging that gentleman to come forward with one opinion that resulted from a lot of consultation with other medical officers of health, including our own. I will say that advice that Dr. Davila began to give us 10 days ago on this subject was consistent with what he ended up saying. And I don't want to put words in her mouth, but I think that's a factual statement. And so, in that sense, I respect all of these other people who I've watched their comments about everything to do with COVID-19 very carefully, because you can learn something from all of them, and I respect them all. But we have our own chief medical officer of health for the province, who we asked to come forward with consolidated advice based on the advice he got in turn from many other people, and we asked for it and we got it. And so now I think it is really necessary for us as elected representatives to accept that advice, as I'm proud that I've done throughout the pandemic. I ask a lot of questions about these things, but I accept the advice in the end because I'm not a doctor and I'm not a scientist, and I don't know enough to be able to know what's going to help contain the spread of this virus and what isn't. I'm satisfied that people have spent the time necessary to try to make the best judgment they can, as much as with all of these things, all of the cancellations of these events and restrictions we had to put on people in parks and all kinds of things that have gone on, the closing of restaurants and bars. This is painful stuff, but in the end, it's based on the advice we have from people who are in a position to know what's going to stop the spread of this virus and get this nightmare over with. And so, everybody has an opinion, but we have to rely on the ones that come from the people that we have working for us all the time.
Okay, that's it for today. Thanks, everyone. Have a great day.